Welcome to Politics Done Right. My name is Egberto Willies, your host. Good morning, Houston. Good morning, Harris County. Good morning, Texas. Good morning to the United States of America. And of course, good morning to the world. We are going to have a wonderful, wonderful program today, especially because out of lemonade, or rather out of lemons, we are going to be making some great lemonade. Folks, I hope as you're driving in your cars this morning, all is fine. Well, we have our wonderful Jacques Van Beber, who was riding into town as he does every morning to bring this to you. And little something happened, but with the magic of, Howard still connecting the strings wherever they are, we're able to bring him into the fold. But before we go to Jack, Howard, what's up?
Well, we lost the last part of Arnie Arneson this morning. For some reason, the computer just cut it off. So we had a chance to play some smooth jazz for you, kind of wake up a little bit, nice and easy. And I know that Harry will be satisfied because we played Peter White and also Keiko Matsui's Bridge Over the Stars. That's some good stuff. Jeff Lorber's Wide Open Spaces. So I got 3 smooth jazz songs in before your show. So everybody will be mellow this morning.
There you go. I tell you, so we're ready to be mellow.
And we got to say good morning to our good friend, Jack Van Beber, who has brought us some wisdom. Good morning, Jack.
Hey, good morning, Howard. Good morning, Egberto.
Good morning, Jack. Great to hear from you, brother.
Yeah, I'm sitting in the Walmart parking lot at Wayside waiting for them to open up to get a tire. So I thought I'd write a little ditty before I went on.
Well,
okay, this is about war. This is about how war comes about. War is men who are looking forward 50 years and maneuvering into position for future profit and power. All war is about resources and resource extraction, dressed up as a villain they have chosen for you. If they can lead you to hate, they can lead you to war for their profit, not and power over you.
Very interesting.
I mean, yeah. It is interesting because sometime on this program, when things are a little calmer in the U.S., I want to talk about West Africa and what's going on with the former French colonies because Van Beber, you opened another can of worms like you always do.
Oh, heavens, they're everywhere now.
Up worm cans, ain't I?
Yeah, you do that really well, Jack.
I don't know, Jack. Sometimes I wonder if are you kind of reading and reading the stuff that I'm reading, brother? What's wrong with you? Anyway, that is great, Jack. All's good out there. Temperature, you're warm, all of that, Jack?
Yeah. I'm just sitting in my car waiting for them to open up. It'll be a long birthday morning, but it'll be all right.
That's right. It's your birthday today. Yeah, it is.
Oh, wait. I got to do this. Happy birthday to Jack. Happy birthday to Jack. Happy birthday to our own Jack Van Beber. Happy birthday to you. All right, Jack. That's all you.
Yeah, I'm a little bit older and a lot less bolder than I used to be. Oh, maybe I'm getting a lot of trouble these days.
I don't know. You sound like a Bob Seger song.
There you go. Anyway, let's get busy. Thanks, Jack, as usual. And, sit in if you want to say anything. Just let us know. Anyway, if a congresswoman, this is the title of the show today. I read this article on Thursday. And Thursday or Friday. I don't remember which day I read the article. And I got I got kind of teary-eyed because I know this woman, Congresswoman Eddie Johnson. I can never her. I always kind of smile, Eddie Bernice Johnson, because I always say her name, Eddie, the first one always throw me off. But she just gave up her seat in Congress, and it was won by another friend of mine who's now out of the the district. It's kind of funny because this time of the morning you go blank. But anyway, she just died. I think it was Christmas, the Christmas Eve, not Christmas Eve, New Year's Eve. And I didn't quite know what the reason was until I picked up the paper, and it was the Texas Tribune. And the title of the show, or not, the title of the article was Eddie Bernice Johnson's family says medical neglect led to former Congresswoman's death. Congresswoman of the United States, a powerful Congresswoman of the United States who served in Congress for 30 years. Not only did she serve for 30 years, she's referred to as a dean of the congressional district from Texas, given her long stay there. She has always been willing to work with Republicans to get things done, etc. She's powerful. She's known. People around the state knows her, around the country knows her. She's a powerful woman. You would think special cases would not, I don't want to say special treatment, but you would think if they go into a hospital, if they go into a rehab center, that somehow, you better not let the standard modus operandi where we treat people not as kindly as we should in hospitals not happen here, because again, it'll make an issue. People would make a further issue out of it. But look, first of all, politics done right, I don't care who you are. If the medical system hurts you, I want to know. And we should do something about it, because we are all one big, huge family. We are all equal. We are all under God, under the law, except for under our capital. Yeah, we're all equal. But it went anyway. But it turns out they allowed this woman who had spinal surgery. She moved herself in her bed and was sitting in it for over an hour over an open wound. The wound got infected from said output. And after a few days, she died. And before she died, she told her son, don't let this go by. For all practical purposes, I'm just paraphrasing, they killed me. Meaning, of course, a negligence. Okay. Good morning, Paul Fleming from Atlanta, Georgia. Thank you for being here. And the reason that got to me is that when, according to the Sun or somebody, it's when they went to the hospital before she died and they're at the station, a nurse couldn't be found. I don't know if you've been to a hospital lately. My wife's mother died in 2019, I think it was. And you would not imagine how difficult or how empty these wards, including an intensive care unit, was with staff. Again, profit maximization. And, we go over this over and over and over again. And I know some people just stay back and they think that why do we repeat ourselves? We repeat ourselves because this continues to happen until all of us do something about it. It will happen to your mother, your brother, your sister, your cousin, your wife, everybody else. If it can happen to Congresswoman Eddie Bernice Johnson, think about how it can happen to you. And the thing about it is there are solutions, right? There are, in fact, solutions. So here's what I got to do right now. Over the weekend, there's this healthcare activist. His name is Wendell Potter. Wendell Potter has been on my radar for a long, long time. He is a former health insurance executive, and he came out and he blew the whistle on the healthcare system. And all of us thought that the healthcare insurance would cave in and will be done with, because this guy knows the inside and he knows how corrupt it is. But I tell you what, their way of convincing all of us, you included, that somehow they have a purpose to exist is powerful. And I see it after writing all these blogs, after writing about this issue, including just over the weekend at Daily Cost, and hearing some of the responses from some of us who seem to be the defenders of a system that may treat you well sometimes, but screws you most of the times. It's concerning. But let's go ahead without further ado and listen to Wendell Potter. This is an interview that we did. I sent him an email after reading a few articles, and I said, hey, man, I would love to talk to you over the weekend if we can set up an interview. And it was funny. He said, oh, absolutely. I'm one of your fans. I'm like, but damn, I'm your fan, man. I mean, I'm a fan of yours like you for a long time. I've been meaning to talk to you for a long time. He said, man, I get your emails every day. I'm like, oh, okay. Thank you. Let me go ahead and play him, and then we'll take it on the other side. But he warmed my heart, but we got a lot of work to do. All right, here we go. Welcome to one more edition of Politics Done Right. I'm Egberto Willies, your host. Listen, folks. He is an American advocate for health insurance payment reform. He is a former health insurance industry executive, a communications director. He is the New York Times bestselling author of Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. He's a critic of HMOs and the tactics used by health insurers. Wendell Potter is one of our leading national advocates for major reforms of the insurance industry, including a supporter of Medicare for All and universal health care. He is that voice that we need to be listening to right now, especially in these times. Welcome to Politics Done Right, Senor Potter. Well, you said Wendell. Welcome to Politics Done Right. How are you doing today?
Thank you, and please do call me Wendell. It's good to be on the show. Thank you so much.
Well, look, let me tell you, it has gone from bad to worse. I remember during the Affordable Care Act, you had said, watch what's going to happen if we don't get the public option in the Medicare expansion. They will game it again. I just want to start there before we get into the core of what we're going to talk about. Your thoughts?
That's right. I testified before Congress a number of times when members of Congress were debating what became the Affordable Care Act. And I said that if they pass that bill without a very good public option, that they might as well call their bill the Health Insurance Industry Profit Protection and Enhancement Act. The House did pass a version of the bill that had a public option. The Senate did not. And so we wound up without it. And I hate to say I told you so, but since that time, big insurance companies have gotten so much bigger, so much more profitable. They're massively bigger than they were when I was in the industry and at that time, to the point that two of those big insurance companies are now number 5 and number 6 on the Fortune 500 of the biggest American companies. Their profits are outsized, and they are just able to do pretty much what they want to do. They're controlling our healthcare system in ways that I feared, and we've simply got to do something about it. We really need to wake up to what's going on.
Now, you were an insider. You were a part of this whole entire insurance industrial complex, if you will. What within your soul made you say, you know what? I'm going to leave these millions of dollars that my future worth would be, and I'm going to do what's morally right. What got into you that? Because I want to, for the audience, I want to say something that's important, Wendell. The current people in the healthcare industry, in the insurance industry, they are doing their fiduciary responsibility, which is to maximize the profits for their shareholders, enhancing the executive bonuses. They're doing nothing illegal. They're doing what they're supposed to do. You are just a cog in the system.
That's
what
right.
Wendell has said is that's not how a healthcare system should be run. It shouldn't be run in that framework. Run with that, sir.
Well, that's right. When I first started working in healthcare, I was working for a nonprofit hospital system in Tennessee, where I'm from. Then I went from there to work for Humana and then Cigna. So 20 years I spent inside two of the biggest insurance companies in the country. And I, at first, was unaware of the implications of for-profit companies or Wall Street controlling our healthcare system. But I became more and more aware of the consequences as I rose up through the ranks at those companies. I was able to see things that most people do not have a chance to see. I worked very closely with the CEO and the CFO, the investor relations team. I came to just see and understand how Wall Street does control our healthcare system or controls those companies and any other company that is an investor based or owned by investors. I had a crisis of conscience. In my first career, I was a newspaper reporter, and I tried to make sure that I was telling the truth and never obscuring anything that was important for people to know. But I came to realize that's exactly what I was doing in my role. I was vice president of corporate communications for Cigna. I worked, one of my name was on every one of the company's earnings releases for 10 years. So I had to know how these companies made money, where it came from and what they did with it. And I came to realize that the way they made their profits was in many cases making sure that people did not get the care that they needed. And the system that we had in place was one in which increasingly Americans were not able to buy insurance. 50 million people didn't have insurance when I left the industry and when Congress began debating what became the Affordable Care Act. I came from humble beginnings. I grew up in rural East Tennessee in a working class family, farming family. And I know what poverty is like. I know what it is like when people do not have access to care. And some things happened to me a few months before I decided to leave my job that just made it abundantly clear to me that I was doing the wrong thing, that I was contributing to the problems in our healthcare system. And I decided I couldn't do that anymore.
You tell a story about seeing people come down from the hills to get healthcare, to get free healthcare, and the impact it had on you, your psyche. Tell me a little bit about that.
Yeah, while I was still in my job, I flew back to visit family in East Tennessee, and I read in the hometown newspaper about something that I'd never heard of before. An organization called Remote Area Medical was hosting a big outdoor clinic at a county fairground not too far from where I grew up. I was curious because the article said people would be coming from hundreds of miles away, even as far away as Ohio and Florida, to get care that was being provided free by doctors and nurses and dentists who were volunteering their time over 3 days. This was in late July, and I went there, again, out of curiosity, and I saw something that just shook me to my core when I went into the fairground. People were lined up by the hundreds, waiting patiently to get care. It was raining that day, so these people were soaking wet, but they were not going to be leaving their lines because they had been, in many cases, sleeping in their cars for days to get an opportunity to go inside the fairground to get the care that they needed. And I saw that some of those lines led to barns and animal stalls on that fairground site. This was a county fairground. And I just immediately realized that I had to take some responsibility for what I was seeing, because my job was to help perpetuate the system that we had in place, the system that still is in place. And I made a commitment that day that I would have to find some other way to earn a living. I saw people there who could have been people I grew up with. Could have been my neighbors, could have been high school friends, could have been relatives of mine, and tears flowed down my face as I was looking at what I was seeing, and I made a commitment to try to figure out what I could do about that. I didn't think I would be a whistleblower. But I just knew that I couldn't keep doing what I was doing, despite the fact that I was making quite a bit of money.
It's interesting because you're a whistleblower, and you've blown the whistle and you blow the whistle over and over again. And it's amazing how the gravity of the system is so self-sustained. And one of the things that I promise to do in my life and with my platform and hopefully with your help and the help of everybody else is to just let the average rank and file American understand what you saw there is not an anomaly, but it's something that's out there throughout this country, the richest country in the world, where we can't get the healthcare that not that we deserve, but the healthcare that as a rich country, we have all earned. We have all earned, irrespective of whether you are a McDonald's flipper or an executive in a corporation. Now, it turns out that in the past, one of the reasons Medicare came into be is because private insurance couldn't quite find a way to profit from the healthcare on older people. So therefore, right, as usual, the things that are not that the private sector cannot make a dollar on, they usually pass it on to the government. The government will take care of that. So Medicare was passed on to the government. Now, following that, bribing politicians, these guys figured out a way we can take back Medicare in a more secure, in a more advantageous way for us. Why don't you explain to us that procedure that occurred that has led us now to Medicare Advantage, one of the largest frauds on the American taxpayers?
You're exactly right. Insurance companies had no interest in trying to insure older people, people on fixed incomes, people who didn't have a lot of money. Those people couldn't afford their premiums. So that you're right. That's why the Medicare program was created. But over the past several years now, past 20 years in particular, these companies have figured out, because of their closeness to politicians, they were able to convince politicians that let us take care of access to care for people who are enrolled in Medicare. We can do it more efficiently. We can make sure that people get the care that they need and cost taxpayers less money. That certainly was, they sold policymakers a bill of goods. I, at the time, thought, well, maybe that is something that can be pulled off. So I was going along with it. But what we have seen is that more and more taxpayer dollars are going straight into these big companies. And what they're doing through their Medicare Advantage plans. Medicare Advantage, by the way, was created in 2003 by when Congress passed what was referred to or called the Medicare Modernization Act. It created not only the version of private Medicare that we have now, but also the Part D prescription drug plan. And both of those programs have turned out to be extraordinarily big cash cows for big insurance companies. And they have been aggressively marketing these plans to the point that more than half of people who are eligible for Medicare in America these days are enrolled in one of these plans. And they're extraordinarily profitable because these companies have been able to rig the system to get more and more money out of the federal government, out of our tax dollars. And one other way that they're able to make so much money is by refusing to pay for care that people need. There's a practice called prior authorization that is used aggressively by these companies to make sure that people are not getting the care that their doctors know they need. So people are dying. People are dying prematurely because of these denials and delays of care in Medicare Advantage.
Now, let me ask the question this way. How do you convince a politician that a government who is administering Medicare, whose sole expense is administering that bill, figuring out how to pay, figuring out if there's fraud here or there, compared to a private company that has to pay high-paid executives, that have to pay bonuses, that has to pay shareholder dividends, that has duplicative services, meaning if there are several insurance companies, each of them have their own database administrators, advertising budgets, all that sort of stuff. All of those are all costs coming out of that same pot that the government would have to spend out of if it didn't. In other words, all those costs are costs not going towards healthcare. It's going towards administering.
Yeah.
Why would they fall for the private sector fallacy that's been told many a times, that in every case, the private sector is more efficient than the public sector?
Really three ways. One is obscuring that kind of information, to hide that, to not talk about that. You don't ever lead with that kind of information. The other is through relationships and ideology. You are able to convince politicians that you have helped fund their campaigns, that are ideologically aligned with your point of view, who have the opinion that the private sector can do anything better than the government more efficiently. And a lot of politicians, a lot of people buy into that. We in this country have this notion that the capitalistic system is sacred, and something that can always do a better job of whatever it might be than the federal government. So you have that. But the other thing is what I was alluding to: campaign contributions and lobbying. These companies are able to shell out millions and millions of dollars every election to campaigns, and they send money to both Republicans and Democrats, and that's protection money. And they spend a lot of money on lobbyists. Every big company has a lobbyist on staff, but also spend enormous sums of money hiring firms that do lobbying in Washington and the state capitals. So you have all of those things playing together, and that has got us to where we are now. It's lying and obscuring information. It is lobbying, and it is campaign contributions, and just frankly, ideology. So many people are blind to the fact that these companies are ripping off taxpayers left and right.
Before I came on with you, the first Saturday of every month, I have a program, an addendum to my radio show called Ask Egberto Anything. And I told them today that I was speaking to you, and, they were very happy to know, wow, you're speaking to Wendell. Ask him two specific questions. Since we're talking about Medicare Advantage, they said, what can we do to change the name Medicare Advantage to something more appropriate to let people know Medicare Advantage is neither an advantage nor is it Medicare?
One thing is to support a bill that was introduced by two members of Congress, Congressman Mark Pocan of Wisconsin and Ro Khanna of California. They are the lead sponsors of a bill that would prohibit these companies from even using the name Medicare in their marketing materials. That is really important because people don't know the difference. And the advertising that they do conflates the two programs. People don't know that Medicare Advantage is really a privately operated big business. They don't really understand that. And the advertising purposely obscures that. So that's one thing. One is to support that legislation, to write letters, make phone calls to your members of Congress to support that. And also to support legislation that would crack down on how they're marketing these plans. There are also bills before Congress that would do that. I'm seeing that members of Congress are beginning to wake up, certainly on the Democratic side, but even Republicans are beginning to understand how the program that they largely created has been ripping off taxpayers, has been depleting the Medicare Trust Fund. But it requires people to reach out to their members of Congress and say, this is something that has to change. And the various ways we have to change it is, number one, like you were saying, keep these companies from even using the name Medicare in their marketing materials.
The next question, and this I think is a difficult question. I don't even know where to start, but right now we spend more than twice what probably the most expensive country spends right now on their health care. How can we, forgetting about insurance and all of that, how can we reduce the amount that's being spent on health care, given that our outcomes are no better than the other countries?
Well, you really do have to have a fundamental rehaul of our healthcare system to do that. The biggest reason is because of administrative costs in this country. About a third of what we spend, and we now spend $4.5 trillion on healthcare altogether, which is, you're exactly right. It's twice as much as the average of all the other developed countries in the world. And those other countries provide better care than we do. And they provide universal coverage and we don't. And it's largely because, number one, the administrative cost, when you have all these insurance companies and for-profit entities involved in healthcare, every one of those adds to administrative costs. When you have these private insurance companies operating All of those companies have high administrative overhead, but they make it necessary for doctors and hospitals to also have administrators, people who do nothing more than work day in and day out with big insurance companies. So that's a big thing. And the other is to just curtail the power of these big companies, break them up. You've got, like I said, United Healthcare is the fourth largest company in America. CVS, which owns Aetna, is the sixth largest. Cigna, where I used to work, is the 15th largest. They're far, far bigger than they were when the Affordable Care Act was passed. We've got to work with our members of Congress and the administration, with the FTC, to call for these companies to be broken up, because we're getting to the point that you've got just a very, very few large corporations run by Wall Street and investors that is really calling the shots, and they don't have any incentive in bringing down the cost of care, because as the cost of hospital care goes up, as the cost of drugs go up, these big insurance companies just increase premiums, and that is costing our employers and all of us as employees and taxpayers enormous sums of money that's simply unknown in other countries.
As someone who understands that Medicare for all, healthcare for all, universal healthcare, whatever you want to call it, one word, we are all have healthcare. It's a right that we all have healthcare. I understand that if there's a single payer handling that, I understand that if we take the for-profit method out of the delivery of the service, out of the administrative service, that it would be more efficient. My question to you, given the infrastructure that we have in this unwieldy system, what would be the pathway? What would be the migration from this unwieldy system into a well-organized healthcare for all system?
It's a very good question. And I think there are various ways of getting there. One is to try to get it done in Washington. That's a very, very heavy lift, as we've seen. There are organizations that have been trying to get that to happen for more than 30 years. The other is through the states. And some states are considering legislation, California in particular, but also other states have legislation that will be considered that would create a state-based single-payer system, or some kind of a system that would be similar to other countries around the world, other developed countries that are doing this much better than we are. So that's one way. I think it is going to be very, very hard for us to see that kind of change in Washington until we do something about who is in Congress. You've got the makeup of Congress now such that it's not going to happen in the foreseeable future. So we've got to get involved in the political process. My second book was called Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About It. And that is at the core of the problem that we have, is that these companies are being able to control the levers of power in Washington and the state capitals. We've really got to address that. And whenever I have a chance to talk to people who support single-payer healthcare, Medicare for all, whatever you want to call it, or just to progressively improve the system that we have, you're running up against the power of these big corporations that spend so much money, as we were talking earlier. So you've got to do something. I ask advocates, try to devote some time and attention to money in politics, because that is so important, so fundamental, and it's a big barrier to getting to where we need to be.
Wendell, my last question is always the same. What would you have liked me to ask you, or what should I have asked you that I didn't?
I don't know that you've covered fundamentally, I think, the biggest questions, the biggest reasons why we are where we are and what we need to do. I think that I would say that to get to universal coverage, let's not get hung up necessarily on one path. We've got to consider how else can we get there? What other things can happen? And I would say that employers have a big responsibility as well, too, because so many of us get our coverage through the workplace. I would encourage people to talk to their employers, to their HR people, to protest the fact that every year our premiums go up, our out-of-pockets go up. So we've got to wake up and realize that our pockets are being picked day in and day out. I lead a coalition of organizations called Lower Out of Pockets Now. There's stuff that has to be done that's incremental before we get to single payer healthcare, so that we're not spending so much money and not being able to pick up our medications, not being able to go to the doctor because of the high out of pocket costs that we are subjected to. So there's a lot that we can do as advocates other than just supporting Medicare for all or universal health care, whatever you want to call it. We've got problems right now. People are dying every single day because of the practices of these companies. So I would encourage people to pay attention to that and call on their lawmakers to do something about the things that can be fixed right away. Rather than looking down the road to achieving a healthcare system that is more just. There's some steps we can take right now to get us closer to where we need to be.
I'm glad you said that, because that also helps me, because there are certain times that I just want to jump on it and get it done all right away. But you're absolutely right. There are things that we can do incrementally right now that eventually puts us on the path there. Wendell, you have a newsletter that is packed with information. And I tell you what, I am ashamed that I didn't quite read your newsletter before. I just read the material that you put out there in the ethos all of the times. I found that I just want you to know, I became a paid subscriber of your newsletter today. Why don't you tell people how they can find your newsletter?
My newsletter, thank you, Egberto. It's called Healthcare Uncovered, or Wendell Potter's Healthcare Uncovered, on the Substack platform. You can find it at wendellpotter.substack.com, or just Google me and Healthcare Uncovered and you'll find it. The content is free. I do appreciate the paid subscriptions because that helps us to do more reporting. We have, I think, some of the best analysis and essays on healthcare that anybody's producing, things that other reporters are not covering. And we have some other voices that contribute as well, too. So thank you very much. And I hope people will sign up. Again, it's free, but we certainly appreciate the paid subscriptions. It helps us a great deal. Wendell
Potter, one of the leading national advocates for major healthcare reform in the country and the author of Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans, as well as the other book that he just mentioned that will also be in this blog. Thank you so kindly for having been on Politics Done Right.
Thank you so much, Egberto. Thank you.
Wendell Potter has been doing this now for years, and he was instrumental as well during the Affordable Care Act in getting a lot of stuff kept in that would have otherwise come out. So we owe a lot of gratitude for him letting us know from an insider's point of view the evil within the health insurance company, so much so he couldn't work for them anymore. He became a whistleblower. 713-526-5738. Please don't wait till the end of the show. Please call now. 713-526-5738. Paul Fleming says the healthcare system in this country is a joke. It is no longer about caring for the sick. It's about money and profits. If you aren't wealthy, you are seen as trash. How many people get treated like this across the country that we don't hear about because they have no one to speak for them? I mean, if it could happen to Eddie Bernice Johnson, where she had to get infected from her own waste because as influential as she is in her old age, they simply ignored her in her bed. That's our healthcare system. Reduce the amount of people taking care of you. Going to the executives and the shareholders partying all night. Look how much money we're making. Why do you go around Houston or any other city and watch all those quick healthcare places coming up? Quick emergency cares. There's all these things like little shops coming up to take care of you, right? It's really to take your insurance money, and it's really to take your money because you pay the insurance, you pay the taxes for all of this. 713-526-5738. Eric Hayes says Washington is dysfunctional. You are correct. Washington is in fact dysfunctional, but more dysfunctional than Washington is a corporate sector. I want you guys to understand this. It is easy for us to just jump at Washington, jump at Austin, jump at all these other places and talk about how corrupt they are. And you would be correct. but they got that way not on their own. They got that way from the influence of money in politics. And who has the money in politics? Our corporations. Don't ever dare forget that. 713-526-5738. Again, the number is 713-526-5738. Let me hear your voices. All of us are dependent on healthcare. We should all be on this subject. We should all make sure that the politicians answer to what they will provide. Let's go to Anonymous, line number 1. Come on in, Anonymous. Anonymous, you're on.
Thank you. I report that I had Medicare Part D for about 2 years. And during 2023, I made a test. I bought no drugs using my Medicare Part D. I paid out of pocket only. I found out that the cost of paying out of pocket while getting a discount from the pharmacy that the pharmacy offered was about the same as the cost of purchasing Medicare Part D plan through Cigna, and it's withdrawing money from my account every month. So I figured there's so little difference, I'm getting out of this. Oh my goodness. Medicare told me that all I needed to do to get out was to call Medicare. I thought, this sounds too easy to be true. I called 3 days later to check, am I in or out of Medicare Part D? And the Medicare person said, you are no longer in Part D. But that's not what Cigna thought. Cigna prepared a bill for me for January, and they will send it, although I have written them 2 letters saying, I don't like the plan, I don't want to be in it, get me out of here. And it will take a month for Medicare and Cigna to talk to each other to decide whether I'm in or out. And meanwhile, I may be stuck with paying for Medicare Part D for several more months while I don't use it. So people should know before they sign up for Medicare Part D, it may be difficult to get out, and before you get in, you should find out how to get out.
Let me stop you right there, my friend. No, you will not pay for it for the next few months. Don't ever allow a private institution like Cigna or any other one to force you to pay something you're not using, to pay something you legally got out of. You are not stuck, and you should not pay it. And if you have any problems, let me ask you you have all your paperwork, you have all the days that you call. Please feel free to, if you're comfortable, to black out your specific information and send it. We will write about it and make sure to get some results on it. In KPFT at politicsdoneright.com. Scan it. If you don't know how to scan, I don't know if you're into that or not. Have a friend do it. Don't send personal information at all, but send enough that we can go ahead and say, hey, let me tell you something. This is who you guys are. These guys, our insurance, these are private insurance companies that administer these government programs, right? And their goal is always to sucker you out of your money. You did your part, Miss Anonymous. You are in control here. You make nobody make you pay because they're thugs. Is that understood?
I agree with you mentally about 100%. But there is a kicker if you turn your back. And here's the kicker.
Yes.
Now I am healthy. I don't need any more than these 2 life-saving drugs that I must have.
I got it.
Okay. But if I cancel Medicare Part D now, which I hope to do, plan to do, want to do, and 2, 3, 5, 10 years from now, I get a serious illness and I must take expensive medication, I will pay for not only the medication and the insurance plan, but also for a penalty of not carrying Medicare Part D. And that's why Mr. Potter is right. We must work through POCAN and CANA and other people in Congress and get this junk into the garbage can.
Now, I want to say one thing, Ms. Anonymous. My statement about not paying it is that you said that you canceled Part D, which means you don't want Part D.
That's correct.
So if you don't want Part D, which means what you just told me, well, you won't get the medication, etc. Then again, if you're not using it and you have canceled it, and because of paperwork they want you to continue to pay it, my statement to you is you should not pay it. You keep your paperwork that shows you canceled it, because otherwise you have paid for something, just giving your money away to the thieves. But I gotta go, Anonymous. Again, you have our email if you want to send us anything, kpft@politicsdoneright.com. Thank you so kindly for your call, okay?
The one message is, if you get in, find out how to get out before you get in.
All right. Thank you very much, Anonymous. Let's go to Melissa. Melissa, come on in.
What's up, Egberto?
Oh, wow. I haven't heard your voice in a long time. I feel I feel neglected.
I'm so sorry.
How are you doing, Melissa?
So anyway, good morning, Houston. So I was trying to ask, I guess, when she said, the other caller, she said the Part D. Now, yes. I've been trying to get my partner out of, because they automatically enrolled him in the Cigna Advantage, Medicare Advantage.
Right.
With UnitedCare. But I was telling him that the Medicare Advantage is a private plan.
Yes.
What do we tell the seniors who are at the age to where they still can handle their business, but yet too stuck and too dogmatic on thinking that somebody's telling them for their good to be on this plan?
Melissa,
because I feel like he is not listening only because he doesn't see it coming out. I said they're attacking your plan, your Medicaid, but you don't see it, so that it's like out of sight, out of mind. So I'm
Melissa, Melissa, I'm sorry. That is what we're trying to do here. I don't only do it here at KPFT. I do it on my internet show. I do it at Daily Kos, Op-Ed News, Common Dreams, constantly. What we have to do is constantly talk to people, constantly earn their trust. And that's all. That's the only avenue that we have, and constantly make them know that the people that they're taught, we have to let them lose trust in the people that are lying to them. And we letting them hear what Wendell Potter say that we have here, letting them read the story in the Texas Tribune about what happened to Eddie Bernice Johnson, one of our stalwart politicians out here.
I knew they killed that lady. But she was in tip top, and just like her, before he even went in, because after the COVID shot, he started getting these complications. So, he was healthy body, like physically he was strong. I'm talking about strong, but mentally, he can be told anything, and then you can, and he'll say, okay, because somebody specifically is telling him. But I, as a representative, was on the phone. Cigna hung up in my face 5 times trying to get him to switch.
Yeah,
they don't care.
They don't care.
But that's what I want to say.
No, Melissa, let me just say one thing so that the whole audience can hear. The idea is that they think they can outlast you. In other words, if you get hung up on 5 times, okay, you're going to give up. We never give up. Never give up. Melissa, I got some more calls I got to get in.
Okay, they ended up with him, though. But he's still on private and with United.
All right, so let me tell you, you keep working with him, all right?
All right, love.
Have a good one, Melissa. Let's jump to John. Come on in, John.
Hey, good morning, Alberto. Thank you for taking my call.
Yes, sir.
All right. So here's the situation. My wife's a retired teacher, and she's in TRS, and she also turned 65 last summer. And so she got on Social Security, and the TRS plan had the gap insurance and the Part D through TRS, which is fine. She took, and that was all good. Well, sometime over the last few months, they just switched her over to Medicare Part C. We didn't find out about anything until she went to the doctor and she got a bill, and it was all paid Medicare Part C. They changed her plan without her knowledge, without her permission, and I'm wondering how many people are out there who have had that happen and don't even know it.
Let me first tell you, it is a cancer. It is happening all of the times. I went to a conference in not Pittsburgh. I went to a conference over in Chicago. Was it Chicago? In Chicago this year, and we were talking about Medicare and how the drug companies. And by the way, it is the government gives a loophole that allow these guys with plans called I think it's called ACE. That in effect, if you are going to a particular doctor, etc., they find a way that they supposedly tell you that they're changing it. Oh, it's not true, but they switch you automatically. What you need to do is, now that you know that, is tell your wife to get back there and tell them, I never did this. Move me back to my Medicare, traditional Medicare. I don't want this crap. It is important that you do this now.
All over that. We've been on the phone, and it's a real circus. They switch you around, and then they put people on who are hard to hear, or they can barely speak English, so they've got a really hard accent, which is hard to understand. Right. So,
John,
they know how to make it difficult for you.
Yeah, and that's the idea. And again, it's a complicity between the CMS, which runs our healthcare on the government side, and the private sector, right? They're really trying to move this stuff to the private sector. We have to get people smart about it, and that's why we talk about it over and over again. I said this year, that is one of my 3 major topics, so that people are educated on what's going on. Thank you, John, for your story. Let me just repeat something. Let me tell you what John is saying, folks. His wife was in traditional Medicare, and somehow they switched her to a program, and I think you're going to see ACE somewhere in your paperwork. They switched her to a plan that ultimately is controlled by the private sector, right? And why a lot of people like it initially and don't complain about it is, all the bills seem to get paid until something major happens. And then you realize, oh, no, you're not in traditional Medicare. You are in Medicare Advantage. Folks, don't keep if you're 65, you keep your eyes on your Medicare and make sure you're not in the private sector. Make sure you are in our government-sponsored traditional Medicare and Medigap. That's what we're all about. Thank you, John, for your call. Let's go to Derek. Come on in, Derek.
Right. Quick, Alberto. This is 2024. We're going to have to stop lying to ourselves as Americans. America is not the richest country anymore. $32 trillion in debt does not make you rich, because you up the debt in above your head. But as far as the insurance companies, across the board, we are being fleeced, because I tried to this weekend do car insurance. Alberto, we are being charged double now. So if you paying a car note that's $300 some odd dollars, they charging you for insurance $300, and the lowest I found was $230.
You know what I did, Derek? I went ahead and. You're correct. Let me tell you what I did. Insurance companies are the richest set of thugs in this country. Let me tell you what I did the other day. I was just sitting down, adding up all the different insurances that I have: homeowners insurance, health insurance, car insurance, umbrella insurance. There are a couple more that we have. By the time you're done, it's several $1,000s, and it's like, that is just money out of your pocket going directly to insurance companies every single month. That's why their executives make so much. That's why their shareholders make so much. And that's why they pay off our government so often, so much to continue with the theft. You're correct. The only thing I can tell you about the auto insurance, folks, is just keep going to the lowest bidder, because you know what? It's funny that they want to charge you, but when it's time to pay, they give you a whole lot. Even if in car insurance, even if they don't come to you, they're trying to get to the other person to get their monies back. This economic system, Derek, is a racket. And the more we learn about it, that's when we can do something about it. Go ahead, Derek.
Yeah, even the gap insurance, Berto, my car had a lady had caused an accident. I tried to go use the gap insurance. They can't find it.
Did you see?
So I just want to let everybody know, consumer beware. You're going to have to get together and fight this thing. Stop relying on the senators instead of calling them senators, because they're not for you. You got to get together and fight. Thank you, Roberto.
Eric, thank you so kindly for your call, my friend. Anyway, folks, we're coming close to the end of the program. Please go to politicsdoneright.com/newsletter. That is where all the subjects that we were going to cover today. Of course, I always have 3 to 5 subjects that we are going to cover in case we don't have callers, etc. But we had callers, a lot of callers. We've been having a lot of callers, so I thank you guys for all of your calls. But the additional subjects I want you to take a look at from our newsletter is about the economy, how the jobs report and what it really means, as well as the story on the president changing his tune. Let's go ahead and run back to El Señor Howard.
Okay, I was just running to the control board. Good morning, Egberto. Boy, it's been a busy day here in the control room, that's for sure. Do I miss Jack? You bet I do. You bet I miss Jack.
Let me tell you, Howard, when I was about to say, okay, Howard, in my mind, I was like, oh, he's going to have to wheel himself to the other side now.
Pretty much. I just want to laud praise upon Jack again, because he's, such a valuable character in this particular radio station. Not only does he do the vacuuming and cleaning around here, he also answers phones and does whatever is needed. So, Jack, if you're listening, thank you again so much. And I know he's probably out there listening with his flat tire in the parking lot going, dang, I wish I was there.
He's listening. Of course, Jack is listening, man. But anyhow, but look, we had a great program. Thank you, guys. Thank you, Howard, first of all, for making this stuff happen all of the time. Thank you, listeners. You guys are great. And I mean that from the depths of my heart. Love you guys. Look, we got to fight this stuff together, folks. We've got to not just acquiesce to the crap. We got to fight it. Anyway, my name is Egberto Willies. This is Politics Done Right. And you guys know how I end this baby. I am what? Out.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.